A very good evening to one and all. On the outset, I would like to thank Sukhada and Anaga for having started this wonderful initiative of Nutri-Bulletin, which is a series of talks. And also for having me here as the opening player on the dietetic side. You must have heard Dr. Tejal and Dr. Gayatri on the topic of hypothyroidism, taking care of the medical aspects. I'm going to be talking about the dietitian's approach. All of you will agree that hypothyroidism is a condition that we all see just way too frequently in our practice. It is a condition that is too common with a lot of questions and many confusing answers. So as Dr. Tejal has explained, thyroid gland is a very small gland at the base of in the front of the neck, but this small little gland takes care of too many of the vital functions of our body, looking after different aspects of metabolism. So may look at it as body temperature or heart rate or the metabolic rate. And when this tiny little gland kind of malfunctions or becomes underactive or kind of lazy, then we have one of the most common thyroid conditions that we see in practice, what we call hypothyroidism. So it is a condition which is self-explanatory. The thyroid gland does not make enough thyroid hormone. All the patients always ask us that, why did I get thyroid? They don't say, why did I get hypothyroid? They'll say, why did I get thyroid, madam? And you would have the same experience. We know that anyone can develop hypothyroidism. Of course, there are certain population groups which are kind of more at higher increased risk. Most commonly women, if anybody who has a family history of thyroid disease. And I think this is very important for us as dietitians to ask and probe. A lot of times people are not even ready to kind of get themselves investigated, get the thyroid function test done, because they are afraid that if it comes up, then they have to be on lifelong medication. So if we probe into their family history and there are family members who already have, we must encourage them to get them tested. If obviously they've come to you with the symptoms of weight gain, fatigue, and many of those which will be discussed a little later. Of course, with the increasing age, the incidence goes up. Even if a lady who has been pregnant or has delivered a baby in the past 6 months, she is at a higher risk of getting hypothyroidism. Somebody who has other autoimmune disease, such as type 1 diabetes or even celiac, of course, is at an increased risk. And then there are some other kind of not so very common factors. The other important feature of hypothyroidism is that the signs and symptoms of this condition are very variable and in fact often subtle, so subtle that they may not be even noticeable. And very often they are attributed to stress. A lot of times when patients go to doctors and they complain of fatigue, even in this say lockdown period, fatigue, tiredness, some amount of weight gain, they would be told that maybe it is stress, so just don't worry about it. But over time, if hypothyroidism is not treated, then of course it can lead to a lot of other health problems such as joint pain, infertility, and heart disease. And in fact, I think this is one of the conditions which perhaps is very often diagnosed in a dietitian's clinic or in the OPD, where a patient comes in with weight gain and she would also say that, I've been kind of tired and I just don't have enough energy. I'm suffering from low energy levels. I also have some constipation and there has been hair loss. My hair is not the way it was before. So maybe we want to ask a few more questions like, do you feel cold more than all your relatives or more than your husband? Is there any change in your voice? Do they have a lipid profile which is kind of elevated? Then there is a possibility that we can join the dots and ask them to get their thyroid function checked. That would be step one. Because very often, instead of treating constipation with high fiber, looking at fatigue in a different way by increasing carbs, looking at cholesterol levels by lowering fat, if we are able to join the dots, and if the thyroid is underactive, then that's the first solution to all the specter of problems. So I think it is very important to get the thyroid function checked. If the hypothyroidism is not treated, then obviously there are complications. And I use this slide, or I use this knowledge to encourage our patients to basically start on thyroid replacement therapy, because again, there is a lot of reluctance because they have been told by relatives and friends that this is a lifelong treatment. Then they are very reluctant to kind of start it, or even if they start, they get their thyroid function once checked, it is normal, and they kind of stop it. So it is very important to tell them that hypothyroidism is not only about weight, it's not only about having low energy levels, but over time, if it is not treated, then it can lead to cardiac heart problems, because the lipid profile will be kind of abnormal for a long period of time. In the younger women, it will also can lead to infertility, which is a big issue. Hypothyroidism also has a correlation to mental health, people feeling low, depressed. This just adds to it if the thyroid hormones are not normal. So use the complications just to encourage patients to start the therapy and continue it. Subclinical hypothyroidism is in fact something that we see even more commonly in practice, where the TSH levels are elevated, but the T3 and T4 levels are normal. And usually there is no outward signs or symptoms besides maybe some amount of moderate weight gain, or even somebody who is trying to lose weight and she's not managing to lose weight. So this is a tricky situation because just with one test, the doctor is also not going to suggest thyroid replacement therapy. They will be asked to wait for a couple of months to get retested. And sometimes the patients are very, very frustrated and keen to lose weight. So this is the time when we cannot use thyroid replacement therapy. We have to wait for another test. This is the time where we should check out for other factors, and our role of a dietitian comes in a big way. So we need to check out any factors which have affected the blood test results, in fact. So somebody who's on heparin will not have normal thyroid function test. Similarly, women who's taking a multivitamin with a lot of biotin, and these days a lot of women take hair vitamins, which generally has mega doses of biotin. Biotin supplements ideally need to be stopped at least 1 week before checking thyroid function, so that the thyroid status is accurately reflected. So again, this is something that a dietitian can kind of probe and advise the patient. And similarly, there are some medications which lead to low hormone levels. These include lithium, which is used extensively as a psychiatric medication, Corderon, a cardiac drug, interferon alpha, interleukin 2, lipoic acid or ALS supplements. A lot of people who are into fitness and who do a lot of Google reading start self-prescribing themselves ALS supplements. So again, this can in fact have an effect on the thyroid hormone levels. So this is something that we need to keep in mind and check with our patients. So then, is there any truth to a diet for hypothyroidism? Can certain foods really improve thyroid function? There will be a lot of people who will say, Madam, I don't want to take the medication. Can you do something through food? Is there a thyroid diet so that I don't have to take thyroid replacement? Here, I'm going to discuss a few points. We all know that iodine is kind of equivalent or is kind of absolutely identified with thyroxine. Now in India, the entire population is prone to iodine deficiency disorders because of the iodine deficient soil of the subcontinent, the entire country. And thus both animal and plant sources of food grow on iron deficient soil. In view of this, India made fortification of salt with iodine mandatory for human consumption. It started off in 1992. Then there was a kind of a break, but again, it has been reimposed since 2005. And in fact, 2011, the Supreme Court also mandated universal iodization of the salt. This is, in fact, one of our most successful public health stories for India, because in 13 out of 36 states, 90% of the population has achieved universal salt iodization access. In broader terms, on an average basis, 3 out of 4 households, that's around 75-76% of the population, has availability of iodized salt. And as this table shows, the northeast states are doing great. It's almost 99% of the households which are covered. But states like Tamil Nadu, Andhra Pradesh, Rajasthan, Odisha, and Jharkhand, the states in red, have a lower penetration of iodized salt. So I think this is also something we need to keep in mind. If we are taking care of patients from these states, then we should be open to the fact that there might be iodine deficiency. Because the recommended requirement of iodine is 150 micrograms per day, the recommended salt iodine fortification level of 15 parts per million provides 150 micrograms of iodine per day, assuming that daily salt consumption is 10 grams. Iodine fortification at this level meets the RDA and also well within the upper safety limit of 1000 micrograms recommended by WHO. So if we are having 10 grams of iodized salt, which is more than what is kind of recommended, but that is what will meet our requirements for iodine. And then of course, there are other rich sources of iodine. For the non-vegetarians, it's the seafood, the fish, the shrimps. For the vegetarians, it's the seaweed, the kelp, which are great sources of iodine. Iodine is also added in the diet through processed and preserved foods as a stabilizer, as a preservative. It is also a component of the red food color, and it is, of course, present in a lot of animal feeds. So the dairy products, the cattle grazing on this, in commercial farming, the hens, the feeding on the feeds which are kind of supplemented with iodine, so that is going to come down into the food chain. So vegetarian and non-vegetarian diets that exclude iodized salt, fish, and seaweed have been found to contain very little iodine. So if a person is using iodized salt, generally there is no problem. But in the current scenario, there are a lot of people who use sindhu namak. They are using unrefined salt because of the huge kind of, the commercial, the advertising campaign that goes with it. It's considered expensive, it's considered elitist. So a lot of people are saying no to the iodized salt for wrong reasons. That is where we need to kind of check with our patients and catch them and in the beginning, and again, ask them to restart on using standard iodized salt. Again, a lot of patients ask, because they've read on Google, can iodine supplements help regulate thyroid function in hypothyroidism? It is true that iodine deficiency can cause hypothyroidism, but iodine deficiency is not so common since the widespread use of iodized salt. If iodine deficiency is not the case for hypothyroidism, then iodine supplements provide no benefit and should not be used. In fact, in some people, too much iodine can cause or worsen hypothyroidism. So, and this is because, again, we see on the market there are high dose iodine supplements like sea kelp supplements available even on the net, and people are just buying them and having them, thinking that they're very, very good for you, especially if the person is hypothyroid and doesn't want to take thyroid replacement therapy. So there's a lot of hype about these high dose iodine supplements, but this can actually trigger more acute thyroid problems. So iodine supplements or C-kelp supplements need to be seen with caution in people with hypothyroidism. They should not be used indiscriminately and definitely not without the advice of the dietitian or the doctor. So this is something we need to check with our patients when they come in, whether they've been using the supplements. And here in this table, you can see it very clearly. A gram of salt, iodized salt, gives you 10% of your daily requirements. It gives 15 micrograms, while a gram of seaweed will give you 18 milligrams or 18,000 micrograms of iodine, which is almost 2,000 times more than our recommended requirement. So we need to be very cautious with these supplements, which are very easily available in the market. And a lot of time patients are tempted to use this in place of thyroid replacement therapy, which is a very inexpensive and a safe treatment. The time when the person is still not on thyroid replacement therapy or is on it and still comes to you for weight loss, we need to look at a few other points also. One is the selenium intake. Selenium dependent enzymes are required for the conversion of T4 to T3. Okay, so if there's deficiency of selenium, if the person is not getting enough selenium from the diet, along with vitamin A and even iron, this will affect thyroid hormone levels. The rich sources of selenium are, of course, the Brazil nuts, seafood and meats, which is easy for a non-vegetarian. But for a vegetarian, it will have to be the whole grains or the seeds such as garden cress seeds, sesame seeds, ramtil, and pulses such as chana, moong, masoor, and peas. Selenium deficiency can be a problem in people who are following keto diets, vegetarian keto, because they will not be having a lot of grains and they will not be having a lot of pulses and dals. So this is a population group that one needs to look out for in practice, whether there's enough selenium coming through their diet. We know that thyroid replacement therapy is the easiest and the inexpensive treatment for hypothyroidism. But again, even if this treatment is in place, a dietitian has a role to play at 2-3 different points. I'll explain how. We know that levothyroxine has to be taken on an empty stomach. It is best taken on an empty stomach at the same time every day. When you check with patients, very often they'll tell you that they have it with their cup of tea in the morning. Or they will have a whole basket of tablets together. They will have their antacid, they will have their thyroxine, they will have their calcium supplement all together. So we need to, again, probe into this, spend time, probe into this, and make sure that they separate this out, and this tablet has to be taken all by itself first thing in the morning, and there should be a gap of at least 30 to 45 minutes to an hour, ideally 1 hour, between the medication and taking any other medication or having the breakfast. I have had some very interesting strategies that patients have kind of used. One lady, when she gets up in the morning at 4 o'clock to go to the restroom, she says, I just pop in the tablet there. So once I get up, then I don't have to wait for my tea, because that tea is very important for me. Another lady, when she gets up at 4:30 for her prayers, 4:30, 5 o'clock, she takes in the medicine. So we need to, again, encourage our patients to make sure that the medicine is taken in the right way, because then only we will also get our results when we are trying to treat the obesity or the weight loss that they are all wanting to happen. Another important thing, thyroid levels can take 3 to 6 months to return to normal. We need to, again, emphasize this to patients. It's not like a hypertensive blood pressure or a sugar medication where you get the results in 3 to 4 days. So even if the person starts taking the medicine, it's not like she's going to start losing the weight in next 5 days. We need to again tell them about this and instill patience. Certain medications and supplements also affect the absorption of levothyroxine. Iron supplements or multivitamins that can contain iron, antacids that have aluminum hydroxide, calcium supplements, some also medications such as sucralfate, all of them kind of hamper the absorption. So obviously these medications cannot be taken together with levothyroxine. Calcium supplements, some of the calcium supplements, have to be taken or are best taken on empty stomach. So very often patients combine this in the morning. So no, calcium supplements do interfere with hypothyroidism treatment. So any calcium supplements or antacids that contain calcium should not be taken together. There should be an interval of 3 to 4 hours between taking the levothyroxine and the calcium supplements. Again, one of the most common questions asked, is it true that people who have hypothyroidism should avoid soy? Whether people who have hypothyroidism should avoid soy is a topic of debate. Soy has long been thought to interfere with the body's ability to absorb levothyroxine, especially the isoflavones, the genistein and the Desai have been found to inhibit thyroid hormone synthesis. However, there is no evidence that people who have hypothyroidism should avoid soy completely. Generally, it is best to wait for 4 hours after taking thyroid medication to consume any products containing soy. Again, I think this is of more importance in people who are trying to go the vegan way, because they're going to have soy milk in the morning. They might have some tofu on toast. So it is important for, again, this group, because generally soy is not so very commonly used in Indian scenario. So the message regarding soy safety is that one needs to monitor consumption if there is a possibility of iodine deficiency, if large amounts of soy or soy products are taken, and if there's a family history of autoimmune disorders, then we really need to worry about it. So if the iodine intake is sufficient, we really don't need to worry as much. Coming to goitrogens, we know that they are substances that interfere with thyroid hormone production. Some species of cruciferous vegetables like cabbage, cauliflower, broccoli, kale, bok choy, they contain goitrogens. And certain millets, mainly bajra, millets which are rich in glycosylflavones, produce antithyroid effects. Again, most of these goitrogens are not of clinical importance unless they are consumed in large amounts or there is a coexisting iodine or selenium deficiency. For those whose diets contain adequate iodine, goitrogens can be safely consumed in reasonable amounts, especially when cooked. So kale is the flavor of the season, is the superstar. A lot of people ask me whether kale can be used if I'm hypothyroid. Kale shouldn't be a problem unless one gets very little iodine in the diet or one is eating large amounts of kale. And this is, again, I see this in patients who are trying to be very, very healthy, who are avoiding the regular salt, are having senda namak, and then are having a vegetable smoothie in the morning where they are dunking in a lot of kale, raw kale in the smoothie. So this would be, again, a typical patient picture where one needs to raise an alarm and ask them to change their habits. So how does one limit exposure to foods containing goitrogens? Goitrogens are inactivated through the cooking process, so limit the amount of goitrogen containing foods eaten raw or simply just slightly steam them. Iodine deficiency is exacerbated by selenium deficiency, as we discussed. So in addition to consuming iodine-rich foods, consuming foods high in selenium is a very good practice. Include iodine-containing foods to protect against iodine deficiency, of course, and the best solution is to use iodized salt. Again, this is for vegans. If soy is your primary source of protein, then you'll have to switch or alternate soy with other forms of vegetable protein, such as pea protein, pulses, and dals. Similarly, if you are drinking soy milk very regularly, maybe 2 glasses every day, then you may have to substitute soy milk with other milk. This is, of course, again for vegans who would not have dairy. So the million-dollar question, any hypothyroid person who walks in the clinic says, how do I manage weight? In fact, even when they inquire before booking the appointment, the first thing they'll ask, I have thyroid. Do you think I can lose weight? Then only I want to come and see you. So there is this whole kind of myth surrounding weight loss that if one has hypothyroid, it is not possible to lose weight. And more than a myth, I think it is a most convenient excuse that a lot of women use for not being able to lose weight or for not wanting to lose weight. So do not blame the thyroid function. The best plan for weight loss is to focus on things that one has to control. Hypothyroidism will be controlled by medication. That's the easiest way. That's the easy way out. There is no big, this is not the complicated part. Everything else has to be controlled by you, by the patient. And that is where all the efforts need to go in. So make the right food choices for calorie restriction, exercise regularly, manage stress. When the body produces a lot of cortisol under stressful conditions, then the cortisol interferes with the production of thyroid hormone. So managing stress is very, very important, learning to manage stress. And getting enough sleep. There's more and more research coming out which tells us that adequate sleep is essential for weight loss. Once hypothyroidism has been treated and thyroid hormone levels are in the normal range, the ability to lose weight is the same as in individuals who do not have thyroid problems. This is something we need to keep telling our patients. They don't want to believe this. They want to blame the thyroid, but they are on the same even plane as somebody who doesn't have thyroid when it comes to losing weight. How much weight loss should one expect to lose once hypothyroidism is treated? Massive weight gain is rarely associated with hypothyroidism. In fact, around 2.5 to 5 kilos of body weight may be attributable to the thyroid, depending on the severity of hypothyroidism. In fact, if weight gain is the only symptom of hypothyroidism that is present, it is less likely that the weight gain is solely due to the thyroid. It's more due to the lifestyle habits. Can thyroid hormone be used for weight loss? In fact, not used, it is misused. Very often we've seen patients stepping up the dose, or sometimes even healthcare professionals stepping up the dose so that rapid weight loss occurs. But this is not the best of the practices. In fact, there are major negative consequences with the loss of muscle protein, loss of bone, and of course, there could be heart problems, issues with cardiac rhythms. And once, of course, the excess thyroid hormone is stopped, any weight loss is usually regained. So this is a practice which one has to completely refrain from. We need to encourage exercise in hypothyroid patients. And in fact, exercise is probably the last thing on their mind, because after all, with symptoms of lethargy, fatigue, swelling of joints, muscle pain, one doesn't want to get up and go. But physical activity can be very, very useful. It can be low impact exercise like walking or even aqua aerobics or even yoga. And there are many ways in which exercise can help in hypothyroidism. Of course, it helps with weight loss. More importantly, it boosts mood, because with exercise, the body releases endorphins and it lifts the mood, it zaps the sad and anxious feelings. So again, very, very important, because underactive thyroid is known to lead to depression and anxiety. In hypothyroid, we need to fight fatigue, sluggishness. Again, exercise will increase energy levels. So exercise has to be very, very positively encouraged in these patients. I would like to end with a take-home message with a few eat right tips. So make sure that there is adequate iodine intake and check on the use of iodized salt. Moderate the intake of raw goitrogenic foods like cabbage and kale. Cook these vegetables. Moderate the intake of soy and soy products, especially important for vegans. Make sure to include selenium-rich foods. Check on the concomitant use of supplements and other medications that we discussed. Check on the timing and method of levothyroxine supplementation. If we take care of these things, then our patients will be going home happy. Thank you for your attention.